Hello everyone, this is Dr. Garner here. I want to talk to you about orofacial release. I've gotten a lot of questions about that, so I want to walk you through a couple of pieces of the orofacial release, letting you know that there are many more options and many more ways that I treat voice to pelvic floor problems, but this kind of gives you a sneak peek window. The first is looking at the immediate jaw area. One is called an underjaw release. So I'm just gonna label these under, kind of over, side, not get too fancy with them. The under the jaw release targets two muscles in this area. The easiest way to do the release is a two-finger approach, where you take two fingers of the opposite hand to treat this side, okay? So you're not treating same side, that does not work. Opposite side to come across. First, I want you to do something weird with your tongue. I want you to push your tongue down in your mouth. See what it does? It really pushes you out. You want to make sure that you don't have tongue tension. You can't do this and have any tongue tension at all. So if you are a performing artist, right? If you are whatever you are, if you're, just working at your desk and your computer, you're a writer, be aware of the inside of your mouth and how much space there is there. If you tend to grip or grind your teeth at night, then you're going to notice some issues here. So this video really is for anyone who might be in performing arts, so vocalist, instrumentalist, music theater, or you just clench, grind, and have jaw problems, or you're a public speaker, a teacher, and you have voice problems, or if you have pelvic pain, endometriosis, interstitial cystitis. There is a voice to pelvic floor connection, that's my specialty, and so I'm here to help you through these problems. You want to spend 30 seconds to 2 minutes at each point. I'm going to go through these very swiftly, but you can, again, take 30 seconds to 2 minutes at each point, realizing that you can do them on both sides. So you're going to come up under this area, trap the muscle against the inside of the jaw or the mandible. Here, this is what the motion looks like. Now, you cannot do these while you're talking. You cannot do them while you're chewing or that you have any tongue tension. So I want you to take the root back of your tongue, drop it away from the top of your mouth. Gently, not so much that you see this. Not so much that you do that. Just a gentle dropping of the root of the tongue away from the top of the mouth, and then you'll spend 2 minutes doing this. Little micro releases, okay? Little micro circles in each direction. The next one you're gonna do is a side neck release. Let me grab my ball for this. Thanks for waiting. Turn your neck and find this muscle. It's called the sternocleidomastoid. It goes all the way up from the mastoid process and has two heads that connect down here to the sternoclavicular joint. When you do your SEM release, now this is a myofascial ball that I have. I just have these printed for my clinic here. Find the middle 1/3. That is the easiest way to treat this. So the middle 1/3 here. Heel of the hand. Stay off of the trachea, off the windpipe. You're going to start to do little micro circles, and when you find the tender point, and you will, most people have one, go to your mindful place. So drop into mindfulness. Find your best abdominal diaphragmatic breath. If you don't know what that is, it's not chest breathing, right? It's not mass breathing. It's not mouth breathing. And it's not paradoxical breathing, which is sucking the belly in when you inhale. All those are stress pain breathing methods, okay? I call it stress breathing. It is not that. If you want, you can go to the AD breath on my YouTube channel, watch that and master it. Or if you want to go to the free library, go to integrativelifestylemed.com, click on classes, and the free library is the first option that you can choose, and there you can learn and master AD breath. Now, you're going to want to use AD breath as you lean into the ball and do a vagus massage, but also this side neck release. So it's a 2-for-1, helps you with stress management, it helps you with vocal performance, jitters before performance, and also orofacial health. The next one you're gonna do is the Masseter. If you don't have any fancy tools, myofascial tools, that's okay. You can use a kid's ball for this. You don't have to have the fancy small myofascial ball that you've probably seen me use in other videos. You can just use your fingers for this. You're gonna bite down. And you'll see these muscles pulsing. When you bite, it pulses and sticks out. Now don't bite, but go where the muscle is when it was pulsing. And you're gonna do 30 seconds to 2 minutes of micro massage. So that's just kind of circles in each direction. While doing AD breath, your AD breath practice is your gateway to mindfulness. So mindfulness does not have to be fancy. You just drop into your center, release the root of the tongue away from the top of the mouth. And you just feel everything begin to release, the tissue begins to melt. Next point is going to be an upper jaw release. So that's the pterygoid here. My cheekbone is here. I'm going to drop right below it. If my mouth is all the way open, it's too tight. If my mouth is clenched, the notch closes. If you'll give me one moment to grab my skull, I'll show you the mandibular notch, which is right here. Press into that area. And this is where you're going to be. Okay? All right. Once you go below the cheekbone, find that area where you're 1 finger width open, circle it out. Now in the clinic, I usually use needles to get into this area. I can also go in and do intraoral work, but this can be really effective for you to do on your own. The last one is coming over the skull. If you bite down again, you're gonna find a muscle in this area called the temporalis. So you bite down. See it move my fingers? That's where you want to be. So spread your fingers out like a cap over your whole skull. You can either go this way or this way. There is no wrong way. So that's good. See how my scalp moves? Especially when I'm not talking. You don't want to move it that fast. You can move it slowly. But the point is, you go in every direction, 12, 1, 2, 3, like a clock, all the way around. Then go 1 to 7, and 11 to 5. 30 seconds to 2 minutes in every area that you can. If you find a tight spot, hold. And just hold until you feel the tension release. Combine that with a really good AD breath. The very last thing that I want you to consider is more therapeutic yoga, based on my textbook, Medical Therapeutic Yoga. You're going to combine all this mindfulness and orofacial release together, and you're going to do what I call a mild mula bandha, which is the ear should bisect the shoulder. Now keep in mind that when you're doing these, your ear should bisect the shoulder the entire time. I've done these in seated, but most of my patients, I'm going to have them do them lying down, not sitting up. It's just too much tension and it's too advanced. But when you are advanced, you can just knock these out sitting at your desk, and get relief from tension headaches, improved vocal performance, less vocal fatigue, released pelvic floor, better breathing, better resilience and coping for your day. The last one is going to be like a turtle pulling its head back into its shell. So you can do 10 or so of these to release tension off of those nerves in the back of the head that can give you that cap feeling type of headache called a tension headache. But you can also do this lying down. You can rest on a blanket in this restorative yoga pose where the shoulders are at the edge and the head is off the back and the chin must be level. So in this position, shoulders here, chin back, the nose can never be up or the chin can never be up. You want it level. And the arms can be resting out to the side. And that's it, you're just resting here. If you find that there's a lot of tension, you can push the head straight back, holding for a couple of seconds. Maybe doing this 5 to 6 times. So you're just moving in the direction of my thumbs. And then rest and relax. Final point, after you've given that maybe 5 minutes of resting here, roll over to your side and press back up. You don't want to sit straight up when you're having active headaches, jaw tension, vocal problems, until you learn how to lift your head without putting a downward pressure gradient on the pelvic floor. That's important because I can see that in clinic by doing ultrasound imaging. So until you master the ability to move your body without too much stress on the voice or the pelvic floor, go ahead and roll over to your side and push yourself up to get up, which is a much safer, much more effective way of getting up. I hope this has been helpful, and if you like my videos, don't forget to subscribe to my YouTube channel, and you can also find me on Instagram at Dr. Ginger Garner.